Okay, this is probably the number one question we're getting: the vaccination rollout, how it's going to happen. We've got our healthcare advocate Colin Powell with us today. Colin, I'm going to let you just hop right into this one because I know everybody is asking this one. So we talked about the risks that we haven't been educated on yet in the last segment, and now we're going to talk about the vaccination progress. So give us an update where you stand, what you're hearing out there in your space.
Okay, so thank you, Jeff, for that lead in with the vaccination. I know that that has been uh, the biggest question. And again, I'm not sure if it should be the biggest question. I'm hope that you guys will go back and look at some of these previous episodes speaking about blood, because I'm hoping that that should be a thing that should be one of the biggest questions. But that also all leads into who is going to need this vaccination, and how it's going to work. So they do all play together. So I want everybody just to understand as we begin, it's not the do I get the test, the diagnostic test, or which test do I get versus the vaccination. It's not an and/or option. It's a one, two, three, and you may or may not be eligible based on. So they all work together concurrently, and right now they are all working very separately. So there's supposed to be an option where the doctor says, okay, based off this test, I can know that I need to be how you tested, give you the antibody test or not, or the antigen test based off how you where you are in this viral shedding period or the neutralization period, and then you haven't had it yet, or you may be prone to it because of this. It's time for a vaccination. So what people need to understand is it's not an and or, it's the final piece of the equation, for what we need to do to actually take this and start running with it and being safe with it. So the doctors cannot make their decisions unless they have really this last option, and that's why I'm so supportive of it. Not necessarily of the specific vaccinations just yet. There is a lot of data that they are working, that they are that there's that it is helping people. But again, even going back to the recent one, where 40,000 people were given the incorrect dose, but they were able to use that. They were given a smaller amount than what they actually were supposed to be given, but they found that coming back and giving that individual the same, another dose, those people were actually had a greater outcome. So, that's science, and science is nothing but building blocks. And you can't. And one things I always tell people, and I just want the public to understand, failing in science is not necessarily a bad thing. And I want people to understand that, because what that allows us to do, to some of my business folks out there, it's you can hedge that. Use that information and allow someone else to not waste months, years, millions and millions and millions of dollars on doing something wrong if you can help point them in the right direction. So, as the American people and as these biopharma and pharmaceutical groups and the government's trying to decide which way they're going to go, no, there are no failures in this except for the ones who don't step up and do something. So, to my knowledge, as of right this moment, I don't distrust any of the groups that are coming out, that are of the big United States ones. I do have some hesitancies of ones overseas, but that doesn't even matter. The vaccination process where we are right now, people they have not started actually distributing the vaccination yet. They've broken it down into certain groups who are going to get it first. Obviously, you think the Medicare folks and the healthcare workers and some of those, the sickle cell anemia patients. But what we're finding is that, again, we just had a government turnover and a whole new task force come in, and a lot of that. So we're actually kind of really starting from the beginning, on top of a bunch of uh, corporations, who are new to the game that have got into this since COVID, as well as a lot of the big ones that have played a role in this a very long time, who it's very hard to get them to change their ways, and maybe have already developed, such as some of the stats we've shown earlier, maybe a negative impression to the community, just by being simply a pharma company or a government group. So right now we have, there's about 100 different types of vaccines that are currently in the mix right now. These vaccines, they there's not a one size fits all for it. It's going to affect different people differently. And so we don't know how that's going to be yet. And we've also found that what's likely probably going to be the case is it's not going to be you get vaccinated once and you're done. It could be a yearly thing, much like the flu shot. So what people are, their first off, their general understanding of this vaccination, does that mean I'm not going to get it again? Does that mean I'm immune to it? No. It does not. Does that maybe prevent you from having such severe conditions? Yes. That's kind of the purpose of the vaccination. If you aren't able to test for it, and while you're actively infected, to do that correct treatment of care to protect you that way. So I want to just go ahead and clarify that, because that is how they kind of play together. And so where we are now is we have about, if you look at it, it's actually kind of interesting because um, the number one thing that they're saying, so there's three phases to the vaccination rollout that you guys need to be aware of. We're currently in phase one. That's not a bad thing. As a matter of fact, I think that as soon as we establish phase two, which we're actually submitting a proposal based off all the collaborators and groups that we've had. We've got some of the most brilliant minds. And if you are one of those people that have is something that you'd like to bring today, for say for the prison health system, or a subgroup that you're like, this is how this needs to be done, we'd love to hear from you. Just let us know, because we are working to do that. And then what we're going to be doing through here, through the Hype Network, is educating you guys on this. Which tests are coming out, who needs to be taking it, because the government does not have an outlet for you guys, and nor does the biopharma and the pharma groups. Again, you've already said you don't want to hear from them, and I don't, and I'm not talking negatively about the pharma groups, because I like a lot of them. I really like a lot of them. A lot of people that are seen as villains. Honestly, they aren't necessarily so bad. They're doing good things, but maybe they're failing, or maybe they're having to follow a rule that people don't quite understand. Or let's just take as a real example of what we see in a lot of times. It's you know what? Maybe this person only has monetary gains in mind, or this company, and that's why they're doing this. Well, you know what? We shouldn't necessarily punish that person either. But we need to just be aware that there are people who have different reasons for doing this, but they're both still regulated by the same regulatory group, that's regulating everything. So you can't really get around a lot of it. But so the vaccination's coming out. You guys may or may not qualify for it. Um, but the only way we're going to know if you qualify for it is if you get tested and we know your blood type when it comes down to it. So, again, going back to that, I think that's going to be very important if you want to be included in this. A lot of people are just saying no, they don't want to have anything to do with it. And the whole reason behind it is because it's really funny. The same answer is both for the public as well as for the government of why we haven't done that. They can't find a medium outlet to discuss. And that's where we come in. We're going to be telling you guys, public, hey, look, what's going on. It's going to go to the jail systems before the prison systems, right? Things like that that you guys don't currently have an idea of, and aren't going to do all the research that we do behind the scenes in our team that does all this stuff to provide all this amazing content live time before anyone else. And so I hope that you guys will use us as kind of a sounding board, I guess you will, of what to trust and what not to, because that vaccination is coming out soon. We are currently out of, for the most part, antibody and antigen tests for certain companies within the United States, and then the manufacturing laws have changed. So they're now being sent back overseas, and now we're having to figure out how to manufacture it in the United States. So we don't have as many tests as what we think that we needed, and we didn't stockpile for that, nor did we stockpile correctly for blood. So we actually do probably need to be focused on, why is this, what, let's give some support to this vaccination, and like be educated on it, because it's about to come out, guys. You guys aren't going to be forced to pay a bunch for it. The government's already put in contracts for this. And it's really funny how they're planning on doing it through groups like, Salesforce and, Deloitte and McKesson and some of these. And you're just like, while they're not in healthcare, and you kind of look, but you're like, that's, that's really smart on how they did it. But none of the groups that we currently have that are making any of the decisions have any healthcare B2B, like hospitals, ambulatory surgery center networks, any of that, nor do they have the patients listening to them. So the only way we're going to be able to do this and know who's whom, and why it's important, and when you need to go, and what's coming out, and maybe who needs to wait over the flu season and all of that. You know, I hope that you guys will take this seriously, because that may be one of the things that save us here. And people hate vaccinations, but just to kind of wrap it up in a quick story, again, we several of the states have already signed up and said they're willing to do it. Not all of them. There's only certain states that are picking out different stages of when they're going to do the rollout, and then they're picking internally subgroups who's going to be getting it first. So it's all completely based on state. However, I have a feeling it seems as though the state has really not a whole lot of control in this. So what we need here is that bottleneck between the state and the federal decision. Really, the tiebreaker, and because we're all on the same team here, is you. So that's where we need the public to come in and to have an idea of what's going on here, because without you guys, you may be getting vaccinated for something that you don't need, and it may be, life threatening to you or a loved one. And particularly, was it 115 million folks have a direct individual who's in the prison system or has been convicted at some point. Well, that's scary to think about, because what about half of those individuals you find within, if you look at the stats, about hepatitis C, meaning if they get COVID, they are actually going to become uh, there's a chance that they're going to have some very serious long-term health conditions. That's very expensive, one, to the United States, but also these are people. These are people, and right now we're seeing more blue-collar crimes than anything for people, violating smaller things, to where the jails and the prisons are full, and so we're actually literally having to create game plans on not how to keep the people safe, but how do we keep our prisoners and inmates safe? We put the IGM and IgG people together? No. Did we put that guard together? And so there's a lot that goes into this, and frankly, it's again coming back to it. The one piece that we're missing is a public outlet source. So for all of your needs on, and coming out with these vaccinations, we're going to be surveying you guys, and we're going to use that information to make big changes. So we need you to stay educated. We need you to stay informed, stay off YouTube, whatever. I mean, yeah, if you see a funny meme, send it to us. We love good laughs too. But know that we, as a group of people, when we step up and do things together, we can make things happen. And we did so, and then I'll end it with this, already within the past decade with HPV. What people didn't quite understand is that HPV is not, first off, just for women. Men should be taking the HPV vaccination as well. But it is actually one of the leading causes of cancer, like 6 different types of cancer. But yet it was being communicated as a sexually transmitted disease prevention. Well, most parents and incoming students at universities, when I used to work in immunization and vaccination compliance years ago and at a national level universities, they would say, I'm not getting the HPV shot. My kid's not sexually active. It was just something about that conversation to where, we had such a hard time getting compliance rates for these incoming students, which in turn made a non-compliance violation and/or the student not being eligible to attend classes and losing perhaps maybe a whole first month semester's worth of tuition and 6 months of their life. Well, because of the SUNY Geneseo mumps outbreak that happened, several years ago, and the way that we were able to handle that appropriately and control it, there were groups like the HPV Coalition and some of that I've had the pleasure to work with, and they used that as an opportunity to educate the public. Now, it may have been a mumps outbreak at the time, but what people don't realize is that that very next year, there was something like an 88-90% increase in HPV compliance incoming students, because that was the time where we could educate and say, look, it's not if we're going to talk about this one right here is important. You guys aren't even looking at it because that's not a sexually transmitted one. Yes, it is, but it's a cancer prevention. And because of that, they have saved, countless lives, and influenced all of America. And it took something just like what we're doing here at, a smaller level, obviously, but us all stepping up and talking about it, and being proactive in it. So yes, we can make a difference in this and make it be a deciding factor. You're not going to have to sit there and say, oh yes, I'm getting this and I'm getting this chip planted into my head, and like, no, stop. Like, you're in control here. And so we want to hear what you have to say. Drop us a comment. Tell us what your major concerns are, and let's address it. Because if we do this right, and we all are communicating and doing this as a team, um, this could be painless and even be helpful. But we're not doing that yet, and we're not there yet. So
And that's a great ending to everybody. We're going to bring you as much information as we can put together. Again, validate everything you hear. It's you know I can't say that often enough, but you're also going to hear stuff that you may have never heard from the mainstream media. So we're here. We're going to bring you as much information as fast as we can. And again, validate, validate, validate. Ask lots of questions, and make wise choices. It's we want to help you and your family, and we're here for you. But check out the extended content at hype.com. Colin, thank you so much for being with us, and we will check you guys out. We'll listen to all the comments that we're getting in. I can see them; they're just flowing like crazy. So we will get all these questions answered as fast as we can humanly get them done. But I think Colin needs to do a little bit of sleeping. So Colin, thank you so much for being with us, and we will see you guys all next time.
thank you, Jeff. Thanks so much for having me.